Throat. The throat, pharynx, and larynx is ring-like muscular tube that acts as a passageway for food, air, and liquid. It is located behind the nose and mouth and connects the mouth and nose to the breathing passage, which is called trachea, wide windpipe, and lungs, and the esophagus, which is called eating tube. The throat also helps in forming speech. The throat contains the tonsils and adenoids made up of lymph tissue. Tonsils are located at the back and the sides of the mouth, and adenoids are located behind the nose. They both help to fight infections. Removal of tonsils and adenoids, when necessary, will not reduce your child's ability to fight infection, since there are many other tissues to perform that function. Pharynx. Pharynx is the muscle-lined space that connects the nose and mouth of the larynx and esophagus. Larynx, also known as voice box. The larynx is a cylindrical grouping of cartilages, muscles, and soft tissues that contain the vocal cords. The larynx is the upper opening into the windpipe, the passageway to the lung. Epiglottis, a flap of soft tissues and cartilage located just above the vocal cords. The epiglottis folds down over the vocal cords to help prevent food and irritation from entering the lungs. Subglottic space, the space immediately below the vocal cord. It is the narrowest part of the upper airway. Throat cancer refers cancer that develops into your throat, pharynx, or your voice box, which is called larynx. Your throat is a muscular tube that begins behind your nose and ends in your neck. Throat cancer most often begins in the flat cells that lines the inside of your throat. Your voice box sits just below your throat and also is susceptible to throat cancer. The voice box is made of cartilage and contains the vocal cords that vibrate to make sounds when you talk. Types of throat cancer. Throat cancer is a general term that applies to cancer that develops in the throat or in the voice box. Though most throat cancers involve the same types of cells, specific terms are used to differentiate the part of throats where the cancer originates. Nasopharyngeal cancers begins in the nasopharynx, the part of your throat behind your nose. Oropharyngeal cancer begins in the oropharynx, the part of your throat right behind your mouth that include the tonsils. Hypopharyngeal cancer begins in the hypopharynx, the lower part of your throat just above your esophagus and windpipe. Glottic cancer begins in the vocal cords. Supraglottic cancer begin in the super portion of the voice box that include cancer that affects the epiglottis, which is the piece of the cartilage that block food from going into the windpipe. Subglottic cancer begin in the lower portion of your voice box below your vocal cord. Symptoms. Signs and symptoms of throat cancer may include a cough, change in your voice such as hoarseness or not speaking clearly, difficulty swallowing, ear pain, a lump or sore that doesn't heal, a sore throat, and a weight loss. When to see the doctor? Make an appointment with your doctor. Find if you notice any new signs and symptoms that are present. Most throat cancer symptoms aren't specific to cancer, so your doctor will likely investigate other more common causes first.